The greatest space that has always existed is the space of improvement. Equity has built a reputation of disrupting and transforming the financial landscape in East and Central Africa, pushing inclusion to a level where 90% of Kenyans have access to financial services. In our journey, we realized 40% of default in our loan facilities occurred when a health incident afflicted a family, and the entire cash flow of the family was redirected. That population is just one incident from insolvency. How do we make health inclusive, to democratize health? How can we come together for the very poor who have no access? That keeps me awake.
Accessibility is a problem in Kenya. So sometimes there are not enough healthcare workers, and most of them are posted to the facilities that are in the urban areas. And there are places where there are no healthcare facilities.
Before I became a doctor, my mother died of leukemia, which is a cancer of the blood. And this particular condition was never detected while she was alive. The results came back after post-mortem had been done already.
A deep dive revealed to us the public medical system was challenged. And as a result, we were feeling a national void of access to health.
Scholars under the Equity Leaders Program
to global universities from financially challenged backgrounds.
We realized that in our scholarship program to university, 1,800 had done medicine. In our circular thinking, we thought of giving those doctors an opportunity to provide the solutions to community.
The first 5 branches were opened in 2016 in Nairobi and its environs as part of the pilot program to roll out Equity Afia clinics.
We largely see upper respiratory tract infections. We serve chronic diseases, especially diabetes and hypertension. We also serve a large category of dermatological conditions at the clinic. Then we have dental and optical services.
The first ever wellness checkup was done at Equity Afia. So I decided, since I've had a really good experience with these guys, let me just walk there and get my liver checked, my kidney, my cholesterol, and it was fantastic.
The clinics solve a big problem in diagnostic services, considering that Equity Afia model is a comprehensive model. All the patients who walk to an Equity Afia clinics are able to get the same standardized services.
And we can see from 5 clinics to 130 within 5 years. So we can see how it can be scaled. The question is, as the brand become more visible or more popular, will we be able to cope with the numbers? Will we be able to expand fast enough? And that is where I think partnership with the Proparco AFD to reach out to other European partners so that we could be able to scale the reach of the network, so that we have capacity and we are not overwhelmed, because being overwhelmed means compromise on quality.
The collaboration between Proparco and Equity Bank is a real partnership, because Equity Bank is not only a client for Proparco. For sure, we provide Equity Bank with senior credit lines, but we also provide them with guarantee facilities, one of them being Euriz. This guarantee is directly provided by the European Union and then being distributed by Proparco. This grant is specifically dedicated to Equity Afia. We help Equity Afia training its medical doctors, especially on management skills.
I moved through a series of capacity building and support from the Equity Afia head office. That is what has been prompting me to see the increase from 1 branch to 4 branches now.
My background is in dentistry. I'm not an entrepreneur. Without the training by African Management Institute, I would not be running these 2 facilities effectively and efficiently as I'm running them today.
I was able to learn on business development skills, that's the marketing strategies. We was able to get financial management skills and the human resource capacity building skills.
We've had physical trainings, and also we have our e-learning portal. We were trained on the issue of risk and risk mitigation and management. We were also trained on the issue of customer relationships.
I've been able to realize that there are many things in business managerial skills that I've really gained that have impacted the current clinic. We have applied those skills, and the break-even point for this facility was even less than the 6 months.
I now want to give back to the community by conducting regular health camps whereby they are both curative and preventive. I'm able to provide these services to the community free of charge at least once in a month.
When we hear that doctors, without the training, they would not have been able to do that, we are very happy, and we think this is the best measure that we can have from our commitment.
The biggest lesson I've learned in my life is about thinking about others. The more we do to society, the more society supports us. If society loves you, nobody can hurt you.